6% of the folks in our district don't get health care through their employer, and they don't get Medicaid, and they don't get Medicare. So that's why we need to do something on health care. And
I get mine from the VA. Can you take my one off of that number?
I would not be doing my job if I didn't try and reflect the district. The national plan is well, can everybody quiet down so I can hear a question?
I want to say I voted for you. And I hope you don't make me sorry. I'd like to know whenever everybody, I think like myself, thinks that things are going too rapid. Can you or would you spearhead a movement to put it back to like December of 10? After the elections?
Well, you know, the question was, can we move this till after December 2010? In all honesty, House members are elected every 2 years. And, you know, my contract's renewed in 08 and 10. And, you know, I don't think I can tell those, you know, 260-something thousand people in our district that, by the way, I'm sorry you don't have health care. We're not going to do anything until after the next election. We just had an election less than a year ago. And I don't think I would be doing my job any more than if there was a new majority in 2008, the Republicans, I can't imagine they would want to put it off until after the election in 2010.
What I'm saying is, you could be, just like Pelosi or someone over there, they get all the limelight. Why can't you go on Rush Limbaugh or bet with somebody and let yourself be known? Let yourself be known.
Well, we're 435 members of the House, and I have to admit, I'm not one that gets up every day to give speeches. I spend a lot of time on my committee work, actually reading the bills instead of just giving speeches, and so that's part of the job. And I've done that. I was a state representative from Northside Houston, the state senator representing this area. And I'm doing the same thing in Congress, and the folks have reelected me for a number of years, and I would hope it's because I'm doing something right. So, yes, ma'am.
Thank you so much for taking my question and for coming out, because I know McCall, his town hall meeting was not scheduled with mine, but please just let me speak.
Oh, so McCall was yours?
I'm glad that you and your wife have been married for 40 years. I recently did just get, almost, that's right, in January. I recently did just get married. I'm a 21-year-old, and I'm not for abortions. But I know a lot of my 21-year-old friends have had. Now, how can you promise me this reform bill will not say we are more likely to cover abortions than for you to have a delivery?
There was an amendment put on, it's not in this bill. Exactly. There was an amendment put on last week that if somebody, right now, if you go out and buy your own insurance policy, you can buy whatever coverage you want, including abortion coverage. This bill, the bill would prohibit any public dollars from going for it. Now, if you want to use your own money, you have that right. But under this bill, there will be not one penny of federal money that will go for abortion services. It's elective. It's elective.
That's not true. When you renew your policy, if you're in a private sector, if you renew your policy, they will not let you renew it, and you're going to be forced, eventually, whether this thing gets passed or not, but eventually when people's policies expire, they will be forced to renew. The amendment that was put on last week to make sure any public money would not be used for elected abortion services. Sometimes it's necessary, and but you know, for elective abortion surgery, it would not be covered by public dollars. The amendment was stripped out of the plan, and I wouldn't vote for it if it didn't have that in there. Congressman Green, it was stripped out of the plan. I think you ought to have the choice, and if you want to go buy it, that's your business. So. Yes, sir.
Yes, my dear wife has something to say, and she's just itching to get this. So she just wants to add a serious point. It's one point in this bill that maybe you can clear up.
Okay.
On page 16 of the bill, if you want to turn to it,
sure.
Section 102A says grandfathered health insurance coverage defined. And it says at the beginning that yes, we will be able to keep our health insurance, except there's certain things that cannot occur in order for us to keep our insurance. One of them is that under your current plan, you can keep it. And it looks like to me it says such coverage that your insurance company, as long as your insurance company does not enroll any individual in your coverage after the effective date of the bill. Okay? Number 2, dependent coverage permitted. You can enroll your dependents, and it won't change your plan. That's okay. So your insurance coverage will apply to your dependents. That's fine. But any other individuals who come into your plan, it says it's not going to be qualified. Number two, limitation on changes in terms or conditions. If your insurance company does not change any of its terms or conditions, including benefits and cost sharing, then you get to keep your insurance.
But if they do change
if
it,
my premiums, in other words, if my premiums go up, if my copay changes, anything like that, Congressman Green,
If you get older.
we cannot. We can't keep it. We'll be back into the insurance.
Congressman, are you on the plan? Are you on the plan?
What it is that the reason this is in here.
Answer the question.
The reason this is in here is because, you know, if you have health insurance, that's fine. But they don't want them to be able to say, okay, well, you're grandfathered in, but you're also going to have to pay double the money. You're not going to be able to cover folks and things like that. So this is, you know, that is, you know, the federal government, just like the state government. The state government has rules on your insurance plans now under state law.
what we're saying is that eventually everybody's going to be under the government plan. And it's we don't want it. We're really concerned about that, Congressman. We don't want it.
Exactly.
No, that's not what the bill says.
Okay.
I'm representing 50 constituents.
See, and I have a feeling if you vote for it, you probably won't be reelected. And I'm just being honest with you.
You know, you got it. Everybody, that's the beauty of our system. You have a secret ballot. You can vote for whoever you want, and you'll get that chance next year just like you did last year. But let me answer the question about if members of Congress can be covered. I've been fortunate my whole life to work, except when I was a kid, to work in employer-based insurance coverage, whether it was at the printing business or whether it's on the federal level. We have employer-based insurance on the federal level that covers every federal employee. Members of Congress, I have the same federal plan that my staff has, or that somebody working for the Department of Energy, or somebody working a civilian employee for the Department.
And put the government on this plan.
Well, okay. Are you gonna let me respond?
No. Come on, Gene.
Well,
That's crap.
but the reason is that the goal of this is not to touch employer-based plan, whether you have it through ExxonMobil or anywhere else.
One change, we're out. One change. That's what it says.
Well, that's the intent of the bill was not to impact employer-based insurance. Now, if that employer all of a sudden says, "Oh, well, we're going to cut off the benefits," then it does involve federal law, and it already does involve federal law. If you work for a ERISA plan, if you work at a company that's under federal law, that's under ERISA, you're already on federal regulation. And because it's a multi-state plan. If you have an insurance policy that just is in the state of Texas, you're under the State Board of Insurance regulation. Well, but
Take the federal government out of it, man.
well, I hear that. How many of you receive Medicare?
Single payer plan.
How many receive? You had your turn last night. You don't get to come. You don't get to come dominated, particularly when you don't live in our district.